Hello everyone, I'm Dr. Shantanu Tandon. I'm the Senior Consultant and the Head of Department at ENT in Sakra World Hospital. Today I'll talk a little bit about earphones or headphones. Now, in today's world, we all are used to using either pods or over-the-ear earphones. We use it either for work and sometimes we use it for pleasure as well. Now, is there a problem if we use these? And if so, how can we mitigate the problems which arise from this issue? The short answer is this is not a problem as long as they are well fitting and as long as you are not listening to anything at a very, very high volume. Now, to break it down, people who use in-the-ear phones, they often have to increase the volume because even though they may be noise cancelling, there will always be some amount of sound which creeps in. Now, what do we do to take care of that? We increase the volume. What does that do? It constantly causes some amount of damage or discomfort to the inner part of the ear. And if this is done for a day or two, it's not such a big deal. But if it is done on a daily basis for a prolonged period of time, it can give rise to degeneration of the nerves and start causing some amount of hearing loss. You won't realize it overnight, but it's something that you should just believe me. It's not something you should do. But apart from that, instead of keeping the volume low, if you use over-the-ear headphones, they are a lot better at noise cancellation, and that is something which can definitely help bring down the volume as well as allow you to function a lot better. When it comes to pleasure, again, we are in the habit of using it for long periods of time. So the duration of usage is also important. If you've ever been to, say, a noisy party or a discotheque, sometimes when you leave it, you find that there is this kind of ringing sound or a blurred sound in your ears. Now, essentially what that does is it causes something called a temporary threshold shift. That means there is some damage to the nerves, which is luckily temporary. And when you get out of the noisy surrounding, then gradually over a period of a day or two, not over a period of an hour or two, it will go back to its normalcy. But if you're using loud sounds through a headphone for long periods of time, this chronic damage can worsen. So it's really important that we keep these things in mind. How do we know that any of this is causing a problem? Well, a lot of young adults often come and say that I have this constant ringing sensation, and this is a very classic sign of early damage. And whenever you see any risky symptoms, either a blurred or blocked sensation in the ear or tinnitus, which is a ringing sound of the ear, introspect, try to figure out whether you have any risk factors such as exposure to loud sounds, and try not to use earphones or headphones for long periods of time. Thank you.